Good morning, Mayor Mike Victorino.
Hello, and good morning to you and everyone out there.
A busy weekend, sir, and, a lot to think about.
Yes, and let's go right into what's happening. As you and I think everyone's aware of, there is a major outbreak on the island of Oahu.
Mm-hmm.
And this is why the inter-island quarantine was established, and I thank the governor for allowing us to do that. I know it's been an inconvenience for people. I ask for the patience. We're working out all the bugs. We're trying to make sure it's as seamless as possible. But I must, our team is working hard to protect you, your families, and the community of Maui County. And that includes Lanai and Molokai, which I have the Lahaina and Manele harbors we need to work on, the Lanai Airport, Molokai Airport, and as well as Maui, Kapalua, and our harbor here. Although our harbor here gets very few traffic. All the major traffic is really Manele to Lanai, Lahaina and back. Sorry. A little tongue twisted this morning.
A lot to think about.
So yesterday we had 355 cases in the state of Hawaii. Maui had 7. We contributed 7. There has been some talk, and I cannot verify this, but there has been some talk that maybe MCCC may have had 1 or 2 cases. I don't have all the details at this time, but I will say that I have been by the medical people as well as the Department of Public Safety that they are making sure everything is thoroughly cleaned and checked and doing what they can to protect the inmates that are confined to MCCC.
Mm-hmm.
There has been a major breakout in OCCC in Oahu, and so I think we've learned some valuable lessons, and we're trying to implement more stringent and safety methods here on Maui. However, because of the proximity and the confinement, we can see that being a hotspot and being very dangerous. So we're monitoring that very closely. There's also a few cases in our hospital, community-driven from what I've been told. However, it still entered our hospital, and they are working very diligently right now to make sure we don't have any reoccurrence of what happened the first time. They learned a lot of valuable lessons the first time around, and they've been wearing their PPEs and their sanitation and following all the guidelines. However, we're not sure where it might have come from as far as from the community. Was it a worker or was it a patient? They're still trying to determine that at this time, and I know Dr. Pang and his group is working very diligently to assess that and get back to us what they feel has occurred. Yeah.
Yep, of course.
A lot of moving parts in this whole pandemic right now here in Maui and in the state of Hawaii and the United States in general. I mean, you've seen the numbers from California and other states, and so it is really indicative of what's going on around us at this time, Shane. And so, you, the public, has to help. We need you not to congregate, 10 or less. Stick with people you stick with or work with or your family. Wear your mask and wear it correctly and wear the best mask you can get. Covering is covering, and they all agree something is better than nothing. But if you wear it correctly and you wear the cotton or the 3-ply and then N95s, I tell people, N95s should be kept for our essential workers, our first responders, our frontline heroes, who are our medical staff and medical providers in our hospitals and our other critical medical facilities here in Maui County. So let's keep the N95s for them. We can do well with what we have, and again, physical distancing. As far as closing down anything, I'm going to say at this point, I'm going to be watching the numbers very closely over the next few days. And if I see what I believe I might see, I will then ask everyone to understand that I have no choice but to step back, and specifically what, where, and how it's being worked out at this moment. I have my medical as well as our team here working on that. But we're trying to keep you safe and healthy, ladies and gentlemen.
Yep.
That is our number one priority.
Number one.
And reopening of the economy and all of that has taken a back step at this time. I hope people understand. I'm still working on that. That has not gone out of viewpoint. But right now, we're really concerned that if we don't get a handle on this surge that has occurred in Oahu and could occur on the neighbor islands, we'll be in a deep world of hurt very shortly.
And especially if we've put in all this hard work, Mayor, in trying to get to this point and the low numbers. Will you be giving us a press conference this afternoon at 4?
Yes, I will have a press conference this afternoon, and my plan is to go back to everyday press conferences next week while we are looking at reopening our schools. I'm not sure how that's going to pan out. I've seen many of the plans, and I tell you, the administrators, teachers, staff, district superintendents have worked so very hard to get ready. I think children are wanting to go back to school, but it's got to be safe. And I will say that it's got to be the priority. Distance learning is one of the methods I think that can help us an awful lot, but it won't solve all our problems. So we've got to look at the different segments, our special needs students, those who live or have very little connectivity with internet and Wi-Fi. You know, there's all these challenges here, especially in Maui County, and the rural counties have this real special challenge. So I've instructed our people to do whatever they can, and I've told the complex superintendents, whatever they need, we will do our best to help them. And so you have my commitment to do what we can, and we are working hard. I don't know what else to tell you, except, Shane, I need the help of the people to help curb the spread. If you don't have to go out, don't go out. If you don't have to be around and out and about, don't. If you don't have to go to the beach this weekend, maybe it's a good weekend not to go. And ask those who are there to physically distance. And you know, you can't wear your mask when you're in the water. I know that. But, you know, if you're on the shoreline and you got a group of people around you, 5, 6, 8 people, even if it is your own family, if you can, wear your mask. Do that extra precaution, you know. Clean, sanitize, and the physical distancing is all we can do as citizens. And we in government and in the medical sector are doing what we can to make sure we ensure your safety.
Awesome. Well, Mayor, we thank you so much. And we'll be talking with you on Monday, but we'll be watching. I know a lot will come out of this weekend.
Absolutely. This weekend will be a telltale weekend in the sense of what direction we take. And also, I'll close with this. We are working with the other counties and the AG, the Attorney General, to make sure that all of our rules for inter-island quarantine fairly match up. You know, again, we were tasked with our own in the county of Kauai and the county of Hawaii. And believe me, we're all trying to look out for the well-being of our citizenry. So this makes it difficult because I may have a little different take, or our medical group has a little different take than some other medical group on the other islands. So please, you know, everybody be patient. We will get it right by early next week. And I think it's gone pretty smoothly. After the first couple of days of glitches, I think we've got it down pretty smooth now. But we want to make it as seamless as possible. And we're not sure, but I want people, the state may reinstitute 14-day quarantine for the entire state. That is another possibility. And Oahu is looking at maybe stay-at-home, work-from-home orders also. So they may be pulling back even further, and I'm not sure how far we'll pull back. I like to think we're doing it right, and that's why our numbers have stayed fairly low. Again, you understood the story that Dr. Peng addressed on Wednesday when he said that they had a new machine. Yeah. They were testing the new machine. So all the results, even though they were accurate, had to be sent to Honolulu for verification. And so with that occurring, we had a backlog. That's why 7 yesterday. We expect 10, 12 today. We expect to get caught up by either today or tomorrow with the backlog of that 4 or 5 days that they were testing.
Got it.
So, and he claimed that there were like 3 to 4 a day, every day that we were finding. And see, if we got 3 or 4 every day, okay, that's not a surge. You know, we expect that with more testing and people being a little nonchalant about the reopening. So But if you hear 7 and then you hear 12, people are going to get a little nervous. Trust me. Let me see what the next few days have, and then I'll get a better tone on what we need and how we need to approach this.
Sounds good, Mayor. Well, have a great weekend. We'll be watching you this afternoon, and we'll talk on Monday.
Aloha, and God bless you all. And stay safe and stay healthy.